insurance has become, extremely, extremely difficult. I've been doing now almost 20 years now. So I started in August of 2005, and I've seen the trend. In the past, you used to get an approval for surgery, no problem. They would approve the surgery right away, or the treatment. You want to go to MRI, you want to, anything. Doctors, it was the relationship between the doctor and the patient. So the insurance was there to help facilitate that. Now, you cannot get any approval hardly. You get rejected a lot right off the bat. You can't order MRI. You can't order CT. You can't get surgery approved. I've had to hire an extra person literally in my office now to help with doing appeal, calling the insurance, phone calls. It used to be very quick, like 10, 15. Now you could be on the phone 45 minutes to an hour on the phone holding. Transfer from this department, that department. They've created more roadblocks in order to get a treatment authorized for the patient. Now, the more expensive the treatment, the more roadblocks. Spine surgery, very expensive in general. So they have more and more roadblocks that they have put up, basically, to get this approved. So then you have to get on the phone with a doctor. I never hardly recall have to talk to a doctor to get my surgery approved. I was never accused of, you're doing the wrong surgery.
So they want you to talk to another doctor, or they want to talk to you?
They basically, we request, I said, I'm requesting, like, why you're not authorizing my surgery? They're like, okay, you can talk to one of our doctors. It's called peer review, peer-to-peer review. Two doctors talking about why I want to do the surgery and what is the medical justification for it. So now they have come up with guidelines. This is where it gets even bad. Doctors, you're supposed to help for the patients, not to help the insurance company. These doctors that are on the phone, I can totally tell they're not talking based on their experience or what. They're talking the guideline of the insurance companies. And a lot of times, these guidelines, sometimes they're flawed. They're based on very, very old information or not correct. There's a lot of literature that supports a different view. So I tell them, look, I have all this literature. I can't go based on that. Why not? Well, I have to go insurance company guideline. So then I say, well, what's the point of this doctor-to-doctor discussion if we can't discuss real evidence? I said, this evidence you're talking is from a decade ago. I have new emerging literature. One time, a doctor said, you know what? I'll get it to you. You know what? Okay, you know what? You're right. I'm going to approve the surgery. I swear to God. Another one came up, and this same doctor came for another thing. I had to talk. I said, remember you approved that for me. I swear to God. He said, I got in trouble for that. Wow. So it's become so frustrating. I'm not a volume guy. So it's not like I have so many patients I see in my clinic. Every patient for me counts, and it becomes very frustrating that I can't get my patients approved, and they're calling me, they're upset, and sometimes I don't have a choice. I just have to go to the emergency room. I have one today, right now. I have a patient in the emergency room today, right now. I had to send because I know it's going to take weeks and weeks to get approval, and this patient can't. She saw me on Tuesday in tears, young lady, yoga teacher, neglected for 3 months, basically.
So the patient has pain. They come to you with the back pain?
Usually, most patients, what drives them to a doctor is pain. For spine surgery, it's usually some kind of a pain there, back pain, neck pain, shooting pain down their arm, shooting pain down their legs or something. It's some kind of a problem that somehow the patient Googles it, or their doctor, whoever, they see a primary care, you have a spine problem. You need to go see a spine specialist. So that's how they end up coming. Most patients are now very educated. They go online, look at it. They have neck pain, that the pain shoots from the neck, down the arm, from the back, shoots down. They know, they're educated enough to go see a spine surgeon. So that's how a lot of them come to me, word of mouth, basically. So they come to me, and it's very upsetting because I feel like you want to help them. These people are literally, they're in tears crying. They're not faking it. And then you call them, they don't care at all. Like they say, you have to go through appeal, you have to do this, and finally, like this patient exactly today that I'm telling you, I'm going to be operating on her tomorrow. I said, you know what, don't worry, I'll take care of you, go to the ER. That's how we have to do it.
So you have to do the surgery through the ER.
Which is really bad because it's more expensive for the system overall.
So the patient has to say, you know what, I this is an emergency. I have to go to ER. I can't do it. And then
That's right.
And then they could get the surgery.
Yeah, I mean, this patient today said, "What do I do when I said, "Tell the truth." I said, "Tell them the truth. How long you've been suffering, what is going on." Like, for example, their leg or their arm starts not working. They start
Like
getting weaker,
numb,
weaker. Like, hey, I can't use my hand. My foot is like it's not coming up. And you tell that to the insurance, and they're like, "Well, the patient has to do 6 weeks of therapy first." I said, by the time they do it, it's too late. Permanent nerve damage.
And what do the insurance companies require from you guys? So you have to justify, right? Before, did you have to do that, or
Not
they
really,
would trust
no.
you guys?
No, they used to trust and stuff. But I get it. Listen, there's some doctors who do bad things. I totally get it. You got to protect. But they have the data. They have the data on every doctor. They can look to see, well, how is this doctor trending, basically, versus this other doctor? How's the patient's outcome? They know what happens after, because they're the ones that are authorizing physical therapy after, narcotics after. So they know the data, and I feel like they're applying a blanket, basically, approach, not rewarding good doctors, but punishing everybody together under one umbrella for money, basically.
And what's the impact on you as a doctor and other doctors?
It's so frustrating. I swear, this is one of the reasons that I talked to some of my good friends who were like, this is one of the reasons you want to quit medicine. Because you went in there to help people, and you feel like there's so many roadblocks. Like it really boils your blood. I mean, for me personally, it agitates me so much, because now I have to sit down. I have to draft, like in the middle of clinic, I have to drop everything, go draft appeal letter. This patient's surgery was denied. Talk to the patient to calm him down, basically. Get on the phone with the doctor, and then you get more frustrated because this doctor doesn't care on the other side about what's going on with the patient, and it just ruins your day.